Low back pain, undoubtedly one of the biggest problems facing people in today's day and age. It is such a serious issue and it really debilitates so many people. In particular, it's the L5-S1 section of the lower back that really causes the majority of aches and pains. Let's have a deep dive into the L5-S1 area, a little bit of understanding around the anatomy and the typical type of pain and symptoms that you could experience with some damage or problems at that L5-S1 area. So firstly, to understand where that area is, the L5-S1 area is right in here at the very base of your spine, just in through here. So it's an area that is just above your tailbone here. And it's really at a crucial area where the weight of the upper part of your body is compressing straight down into that area, really with quite a lot of weight and force. The disc, which is the cushion between L5 and S1, is the most common disc that ends up being arthritic, degenerated, bulging, protruding, or prolapsing. It's the most common joint that people undergo spinal surgery for. But why is it that way? Well, the reason why the L5-S1 area ends up being damaged and causing so many problems is because it's got to play a role between strength and stability to help hold you up like the base of support for your upper body. But it's also got to be able to provide adequate flex and movement to allow you to move in all the directions that you want to move. So it's playing this role which is really quite divergent, a stability role and a flexibility role. And then when you couple that into the amount of time that people spend sitting nowadays, it really undergoes a lot of stress and strain through that joint, which creates the problems within the joint structure, within the disc structure. With regard to the joint structure, we have joints at the back here where the bones hinge and pivot. These are called facet joints. Now those facet joints are richly full of nerve endings. And if the joints through here stop hinging and pivoting with the freedom that they're meant to have, there's a degree of being locked in that area, the nerves get aggravated. And when the nerves get aggravated, you might be starting to experience a build-up of pressure and pain through this area. But furthermore, when that happens, because of the nerve irritation from the joints, we may start to experience what's known as referred pain or radiating pain. Now, this sort of pain is interesting because it tends to follow the pathway of where the nerve of that L5-S1 area distributes information to. So that is down into the buttock, through the back of the buttock, through the back of the thigh, through the back of the calf, through the side of the calf, into the foot. So the pain that can come about from the nerve irritation from the facet joints is very similar to the pain that can come about from irritation to the actual cushioning disc. And it's very common that people feel that they have a disc bulge or disc herniation, which may in fact be more a mechanical jamming up of the actual facet joints, leading to very similar types of pain or symptoms, not just pain. So the common symptoms include pain into the buttock, the thigh, the outer leg, and into the foot. We could get some numbness, we could get some tingling, we could definitely get some cramping, we could get some weakness, and if it got severe enough, we could even get some feeling like your foot's dropping because of the weakness in being able to even hold your foot up against gravity. So those sort of symptoms can come about from severe aggravation through the facet joints or through the disc prolapsing or bulging. So there is ways that we can differentiate between the two. Probably the most accurate way is through getting either a CT or an MRI. But in many cases, the symptoms are very similar, and in fact, the treatment's very similar. Now, something you can do at home to determine if you've got sciatica, which is pain or symptoms in the leg, which is likely coming from that L5-S1 area, is to sit down on a chair and straighten the leg up at the thigh, the leg that is sore. Just like this, you would literally sit and straighten the leg up. And if you straighten that leg up and it aggravates anything you're feeling in the leg, it starts to pull at a very high intensity, it's highly likely that you've got aggravation at that L5-S1 area. Then the next step would be to determine, is that aggravation coming from the disc being bulged or prolapsed, or is it coming from the facet joint in through that area? And as I said, that's often when an MRI or a CT is helpful. Now, there's a variety of things that can be done for L5-S1 symptoms. It's not always a case of surgery being required. There's a variety of home activities you can do. There's a variety of therapeutic or clinical interventions of a low invasion that can be done, such as hands-on care. I will cover some of the simple things that you can do in subsequent videos. But the take-home message is it's super common. It's almost going to affect nearly everyone at some point in their life, that L5-S1 area aggravating them. And if that is the case, there is hope. It doesn't mean that it's going to be there forever and never disappear. And it's either highly likely to be coming from the facet joints, more commonly from those areas being locked and jammed, than it is from a disc bulge or a disc prolapse. I'll cover more information in subsequent videos, but at this point in time, I hope you've got some information out of this and that the knowledge from this you can use to your own advantage. If you have any questions, just type them and I will be sure to respond. Have a great day. I hope you actually are experiencing great health and well-being and that none of this is bothering you, but if it is, I hope that it's been of use. Thanks for watching.